A very dear aunt of mine lost her life due to breast cancer, and that left an indelible impression on me.
Personal drive and innovative spirit have led Professor Anant Matabushi to groundbreaking discoveries at Case Western Reserve University.
My research is focused on using artificial intelligence and machine learning to diagnose the presence of disease, but also personalize treatment.
In other words, Matabushi and his team of more than 50 researchers go beyond teaching computers to diagnose illnesses found on scans. They also apply technology to help determine which treatments to provide.
We could come up with a prediction for who has the more aggressive disease and therefore requires chemotherapy from the ones who might just need surgery alone.
They also have identified ways to tell whether an issue seen on a scan requires more invasive procedures for a firm diagnosis.
Everyone is scared of lung cancer. Many people undergo lung cancer screening examinations every year, and we find lung nodules in many of them.
So what we found in patients who tended to have cancerous nodules, the vessels that feed the nodules were very twisted, very convoluted. In patients who had benign nodules, the vessels tended to be much smoother, less convoluted.
I was never taught about that, like you should look outside the nodule. It has a great potential in saving more and more patient lives.
Matabushi's research extends well beyond cancer.
Diabetic retinopathy is a growing problem worldwide. We typically treat patients with a more severe stage of the disease with a series of injections into the eye. Anant is collaborating with a number of clinicians at the Cole Eye Institute to identify who might need more intensive therapy versus less intensive therapy to achieve a good visual outcome.
We have started to use artificial intelligence in cardiovascular disease, in Alzheimer's disease, kidney disease. We're just scratching the surface.
Matabushi's distinct enough that he has nearly 100 patents approved or pending, more than $35 million in federal research support, and increasing national attention, as when Prevention magazine named his lung cancer findings one of the 10 most incredible medical breakthroughs of 2018.
Following that story, I got a whole bunch of emails, phone calls. There's a real need, urgent need, to be able to take these technologies and really get them out there.
Collaborations with physicians represent a key step in that process.
I'm very fortunate to be surrounded by this fantastic medical ecosystem right in our backyard.